Welcome to our show. I'm Daryl Carver. After months of hard work by a team of medical professionals, Fulton County officials announced their strategy to end AIDS in Fulton County. The news came on World AIDS Day 2015 and was met with great applause and great hope. FGTV's Lynn Vaughn starts us off.
Fulton kicked off its World AIDS Day commemoration in Assembly Hall with details on a new plan. It was put forth by the HIV/AIDS Task Force established by the Board of Commissioners a year ago. Entitled Building the Strategy to End AIDS in Fulton County, the plan calls for increased education, prevention strategies, support, and awareness. Those goals are in line with steps Fulton Health Services has already initiated to end HIV in the county.
I invite you to join us in continuing this fight. We can do this. If San Francisco is doing it, we can do it as well.
The full board supported the creation of the task force as put forth by Commissioner Garner and Chairman John Eves. Phase 1 of the task force's work has been to assess needs and to target services toward them. It wants to eliminate perinatal HIV transmission, link diagnosed persons to care within 3 days, and increase the number of people who know their HIV status. The task force estimates 2,800 people in Fulton don't know they are infected.
Our next part will be to go to the community to get their input on how do we get to those goals? What is it that they want to see us do? And how can they make a difference in changing people's lives?
The day continued with a partnership with Georgia Equality. The group has a specific interest with youth who have HIV. Young people under 35 are hit disproportionately harder, so the county is working with 11 youth HIV policy advisors.
What's great about this program is that it comes from young people who are personally affected with HIV, so they know what it means to live with HIV, and honestly, you need people living with HIV to help you stop HIV.
The HIV task force will work toward the new goals and review phase 1 of the strategy plan in May 2016. Reporting for FGTV, I'm Lynn Vaughn.
Now, Jeff Cheek is the director of Fulton's Ryan White program and also a member of the Fulton County Task Force on HIV and AIDS. And first of all, Jeff, thank you for being here.
Thank you, Daryl. It's great to be here with you today.
Now, this all was big news on World AIDS Day, and I'm sure great news for those who work on behalf of folks with HIV and AIDS.
I think it was very exciting. Fulton County has been committed to HIV services for a number of years, and we've been very supportive of having community input. We have a prevention planning group, and we have a Ryan White care group that have been looking for years at how can we best provide services. But the difference is with the HIV/AIDS strategy, we're saying how can we end HIV in Fulton County, and how can we reach that day where we no longer have to provide services to people living with HIV.
Now, you've had to look at a lot of these statistics, and frankly, a lot of them are staggering. Mm-hmm. Where do we stand right now in terms of other cities in the United States, other counties in the United States?
Sure. Well, when you're looking at the number of cases as a whole, we are number eighth among all cities in the United States. When you're looking at new cases of HIV, we're number 5. So we're doing a better job of getting people in care, keeping them in care, but we're not doing as good of a job of keeping people from getting HIV disease. One of the other things that we like to point out is that in Georgia, 1 out of every 3 cases of AIDS lives in Fulton County, and 1 out of every 4 cases of HIV lives in Fulton County. So the epidemic is great here among our community.
And I was going to say, at that event, one of the things we heard over and over again was the use of the term epidemic, and sure. A lot of the health professionals describing it as a true public health epidemic. Mm-hmm. Why was a different strategy so desperately needed as a result of that?
Sure. Well, when you use the word epidemic, typically you look at the definition that's supplied by the World Health Organization. And they say that concentrated epidemic is when you've got about 5% of your population, of a targeted population, that has HIV. But you have a general epidemic when at least 1% of your population as a whole is affected by HIV disease. Emory University did a study a couple of years ago that saw that in Atlanta, in Fulton County, the percentage is about 1.34%. So we are right there with many developing nations in the number of people that are living with HIV disease among our population as a whole.
Now, in some of the talk about what the strategy entails, kind of go into a little bit about what exactly is being called for here.
Sure. Well, what we're calling for is ensuring that we are letting people know about HIV disease, getting them in to get tested, and if they find out that they're positive, getting them into care and treatment. What we found over the past years is that if we get you started on medications, not only is your health improved, but there's more than a 95% chance that you won't be able to spread the disease to other people. So we're working to make sure that people get tested, get into care, stay in care, and get on medications. We're also looking at prevention in a whole different way. Science has recently shown that if individuals take medications called PrEP, which is pre-exposure prophylaxis, they can actually protect themselves from getting HIV disease. So part of the hope that we have as a community is that we could really stop the spread of this disease. And I think it's also important that this plan is aspirational, that as you heard Lynn talk about earlier, we're saying we want to get people into care within 3 days. Well, that's pretty impressive because the national standards have been that you get folk into care within 90 days. And they're saying, well, now maybe let's get folk into care within 30 days. And what we've said is we want to have the audacity to dare to say we're going to do that even better. And we in Fulton County are going to get people in care even quicker.
You want to get this strategy to the community. How do you plan on doing this, and what do you hope to get from that community input?
Right. Well, we've gone through the process of setting the big goals that Lynn talked about earlier. What we now need to do is sort of develop the roadmap for how we're going to get there. If we say we're going to get people into care within 3 days, what does that mean? What does that mean for our agencies that provide services? What does that mean for people that provide testing? What does that mean for the community as a whole? So what we've done is we're having input from our different planning bodies, such as the Ryan White Planning Council and the Jurisdictional Prevention Planning Group. But even more importantly, we're going to the community through a series of listening sessions. We've had a series of those throughout previous months. We've got 2 more coming up in December and a series in January as well, where we're inviting people to come out and say, what do we need to do about prevention and what do we need to do about care?
I think a lot of people don't know about the efforts of the Ryan White office. If you can kind of go into what exactly your team does there.
Sure. Well, we have a very exciting job, and that is to work with our community to make sure that they've got the funds necessary to provide services to support people in care and treatment. But in addition to providing medical care, which is overwhelmingly important, we also know that we've got to address those other challenges that people face. So we also fund mental health services, substance abuse services, transportation so that people can get to care, meals so that people are able to stay healthy and take their medications. So we're looking at a whole comprehensive series of services. And what our role is to do is to find out from the community what the needs are, how they would like to see that money spent, and then pick agencies that can best provide those services. For example, last year we provided services to more than 14,000 people, and 12,500 of those got primary care through our services.
Now, just your final thoughts on the issues with HIV and AIDS here in Fulton County, and really what sets Fulton County apart in terms of the demographic that you deal with people suffering from HIV and AIDS as opposed to a lot of other cities.
Sure. I think what people need to know is that in Fulton County and in the state of Georgia, HIV is among the top 5 causes of death for all African American men between the ages of 25 and 54. When you're looking at the age group 35 to 44, it is the #1 killer of African American men in Fulton County. So we've had a very clear wake-up call, and we know that the challenges are there. But I think we as a community are ready to stand up and face those challenges and to demonstrate to other communities that we are ready and willing to fight our epidemic and to end the spread of HIV disease.
It's a huge task you have ahead of you. Jeff Cheek, the director of Ryan White, thank you for joining us.
Thank you. It was a pleasure.
When we come back, we will have the executive director of Georgia Equality. Please stay with us.